UK Healthcare Community Connection is sponsored by UK Healthcare.
And for our latest UK Healthcare Community Connection, we are pleased to be joined by Dr. Marc Paranzino.
He's here to discuss the up-and-coming field of sports cardiology. So kind of break it down for us. What is sports cardiology and how does it differ from general cardiology?
Well, thank you so much for having me this morning. I really appreciate it. This is a field that has really gained momentum in the last 10 years. I think maybe more rapidly as of recent with some of the high-profile cases that have gained national attention. But I often get asked this question, what is sports cardiology? And I tell people this is general cardiology applied to a specific group of people. That's athletes and highly active people. And I think the value of a sports cardiologist is the education and the skills of knowing what's normal and what's expected in an athlete versus what are worrisome symptoms that maybe should be further investigated and looked into.
So what we're hearing you say, doctor, is elite athletes and people who run all these marathons, they're the last people, or really are not the last people, that need to come see you. It's still very important for people in that category, right?
Yeah, no, I mean, it's a great question, a great point. I think there's this common misconception that athletes or the fittest of the fit can't get sick or can't have heart disease, and that's simply not true. I tell my patients often that you can't always outrun heart disease, and it's particularly the case if you have a lot of family history of heart disease. And so I think in sports cardiology, we make this distinction kind of arbitrary at the age of 35. With those patients and athletes under the age of 35, they typically, if they're going to have heart problems, they're congenital, meaning there's something we're born with, or genetic, a gene that expresses itself over time, versus those over the age of 35, the so-called masters athletes. We talk much more about acquired heart disease, meaning the two most common being coronary artery disease or narrowing of the heart arteries, or electrical problems such as atrial fibrillation.
And we're talking a lot about the elite athletes and marathon runners, but is there anybody else who can benefit from having a consulting session with a sports cardiologist?
Yeah, no, of course. You don't have to be an elite athlete to benefit from the specialized care of a sports cardiologist. This is anybody who exercises, who wants to be active, and they want to do it safely. So people who are running marathons or half marathons on the weekend, people who are in master swim classes, or somebody who's just wanting to start an exercise program. You know, there was a study that was recently published looking at data from NCAA athletes over 20 years, and it showed that the rates of sudden cardiac death are decreasing during this time period. I think that's a testament to the field of sports cardiology. So I think with the support of Gil Hart, our sports cardiology program is really addressing a need of kind of unfilled need, particularly in this area, and that's high-level athlete-specific care for those with heart disease or concerns about heart disease.
Well, it's obviously so important that it's come to the forefront. Sadly, it's taken some high-profile deaths, likes of Hank Gathers, people like that, to bring it to the forefront. But we are so glad that there are places like UK Healthcare to help these athletes going forward, the ones who are still striving to do greatness in their sport.
Absolutely.
Doctor, thank you for coming in this morning.
Thank you for having me.
I'll be right back after the break.